This is Dr. Iris Rosenfeld, and I am from Laguna Hills, California, a doctor of chiropractic, and I'd like to welcome you to Peanut's Corner. And I named it Peanut's Corner after little Miss Peanut here, my dog. Okay, so this month we are going to discuss women's health. And I would like to discuss with you the difference between the choices you have between saliva hormone testing and serum hormone testing. So the difference is based on whether or not the hormones are bound to proteins in the medium used for testing. The majority of hormones exist in one of two forms, either free, which is 5%, or protein bound, which is 95%. It is only the free hormones that are biologically active or bioavailable. Those which are protein bound do not fit those receptors and are considered non-bioavailable. When blood is filtered through the saliva glands, the bound hormone components are too large to pass through the cell membranes. Only the unbound hormones pass through and into the saliva. So what is measured in the saliva is the bioavailable hormones, which are clinically relevant and will be delivered to the receptors in the tissues of the body. Salivary hormones levels are expected to be much lower than serum levels, which are unbound hormones and are being measured. When your doctor orders your serum hormone levels, they may prescribe hormone replacement therapy that may be overdosed and too high. Therefore, saliva may be a better choice. So why would you test your hormone levels to begin with? We know that hormones are powerful molecules and they are very essential for maintaining physical and mental health. We think of estrogen as the female hormone, and we think, of course, as testosterone as the male hormone. However, men and women both need to have those both hormones in balance. We know that one size does not fit everybody. So your hormones are like your fingerprints. Imagine that. And in order to achieve optimum health, you need to know what your specific imbalances are. And that's what we're all about. There are several ways for us to treat hormones. We can go through saliva, we can go through serum, and as well through urine. But the state-of-the-art method today is saliva. And that's because like I said before, only the active portions of hormones are measured, and it is these portions that determine how the individual feels. So who should be tested? Men and women concerned with hormone levels as they age may want to consider being tested. If you're having PMS symptoms, that may be a consideration for you. If you're in perimenopause or postmenopausal, women may want to also get their hormones tested as well. If you're having any kind of symptoms that may involve fatigue, you're feeling very tired, are you having trouble sleeping at night, some insomnia, under a lot of stress, and who isn't under stress today, yes? Immune problems, some blood sugar problems, are you having trouble with your weight? You should definitely consider having your cortisol levels tested as well as your sex hormones tested. Both men and women of any age who are having symptoms of hormone imbalance should test for hormones associated with the symptoms that I just mentioned. Men and women over the age of 40 may want to consider having their hormones tested as well. And also may want to get a baseline test. Well, which hormones? You're probably saying, well, what should I test? Which hormones are most important to test? So there are the major sex hormones to assess are estradiol, progesterone, and testosterone. The main adrenal hormones are DHEA and cortisol. So let's talk a little bit about estrogen. There are three types of estrogens: estrone, estradiol, and estriol. The form that was found in concentrated pregnant mare's urine, or Premarin, is the estradiol. And as we know, that that hormone has a greater risk of growing the linings in the uterus, a greater cancer-causing risk for breast and endometrial cancer in women, and prostate gland cancer in men. So we're suggesting to consider more of a bioidentical type of formula using estriol matched with estradiol in a combination to provide protective effects and additional estrogenic benefits. In addition, progesterone may be considered, and progesterone is anti-estrogen. It balances estradiol, and it has proliferative effects. It's preventative for breast and prostate cancer and also helps for osteoporosis. Too little progesterone promotes menses, breast tenderness, urinary frequency, depression, irritability, increased inflammation, irregular and prostate gland enlargement, or benign prostatic hypertrophy. Testosterone is an anabolic hormone, which means it builds tissue. It is also testosterone essential for men and women, and it's necessary for bone health, muscle strength, stamina, nice and strong, yes, sex drive and performance, heart function, and mental focus. DHEA is an important adrenal gland hormone, and it's essential for energy production and blood sugar balance. And DHEA is the precursor hormone for testosterone. Cortisol is we call it the waking day hormone. It should be highest in the morning and lowest at night. So you have your energy when you wake up in the morning, and when you're going to sleep at night, you can calm down. It is also necessary for energy production, blood sugar, metabolism, and it has anti-inflammatory effects, and it has a stress response as well. Some of the common imbalances identified through testing include estrogen dominance, estrogen deficiency, progesterone deficiency, androgen excess or deficiency, and adrenal dysfunction and adrenal fatigue. Well, you're probably saying, well, you've just told me all this, but I have no idea where to start. Okay, so we believe that at a bare minimum, you should start with treating 5 S hormones specifically: estrogen, progesterone, testosterone, DHEA, and at least your morning cortisol. Morning cortisol levels represent the maximum output of cortisol for the entire 24-hour period. We know that DHEA is the anti-aging hormone, so measuring the DHEA and your AM cortisol is your first glimpse into the status of your endocrine balance and function. So as we age, our production of sex hormones is changing. The adrenal glands will maintain a central role in sustaining optimal health and function. Aging is often first noticed when our sexual function diminishes and menopause or androbalance have begun. In my opinion, my suggestion is a comprehensive panel, at least your first time through, when you're first getting your hormones tested. And that would be for men as well as women. And that would test 8 different factors: 4 cortisols, your estrogen, your progesterone, your testosterone, and your DHEA. I'd like you to consider checking out an informational 10-minute presentation in addition to the information that I've given you today that may clarify some more points for you. Go to everywoman.labrex.com. Also, this month we are doing a special. And if you come into our office and you'd like to get more information about saliva hormone testing, we are giving you 10% off your saliva hormone tests for the month of October. Additional information can also be found at a book called Slim, Sane, and Sexy. You can go online and get that book, or again, you are welcome to call our office. If you would like more information about our office and any other procedures and treatments that we do, you are welcome to call our office at 949-380-7215. You may also check out our website, www.driris.com. Thank you for listening, and I look forward to seeing you next month.